Good evening, everyone. I am here for my paper presentation. Eardrum revival exploring TCA potential in small tympanic membrane perforations. Chronic suppurative otitis media is widely present in developing countries like India. It is attributed as a leading cause of treatable hearing loss. Factors like treatment cost burden and invasiveness of surgery. Surgical approaches had led to innovate and investigate simple non-surgical method to achieve the same result of successful closure of small perforation without subjecting the patient to risk of surgery and anesthesia. Thus, we have conducted this study to see the effect of trichloroacetic acid application for small tympanic membrane perforation, which is non-invasive and cost-effective method. A total of 25 patients attending ENT OPD in tertiary care center are included. The inclusion criteria include all cases of CSM safe, inactive with small perforation having hearing loss in proportion to the size of the perforation. Patient with small traumatic perforation not healed after 3 weeks of period. Small post-operative residual perforation. Exclusion criteria includes patient with CSM unsafe, patient with hearing loss not in proportion of size of perforation, patient with safe CSM with ossicular erosion, hearing loss more than 40 decibel, patient who are not willing for enrolling in the study. Procedure: the patient were taken up for the procedure only in OT under sterile condition. 2% xylocaine was used for local infiltration by post-oral injection to provide adequate local anesthesia. Under the automicroscopic vision, 20% TCA was applied eventually at the edge of the perforation using a sterile Japson Horn probe until a white cauterized margin of 0.5 mm in width was created. Precaution was exercised to not expose the promontory to trichloroacetic acid while performing the procedure. Excess TCA solution was removed using sterile dry cotton pledge. This procedure was repeated at weekly interval for maximum 4 times. After the first application of TCA, subjects were given oral antibiotics and antihistamine for 1 week and called for otoendoscopic examination after 7 days to assess the perforation size. Subject which shows healing of perforation margin underwent PTA to assess the hearing. These are the images of the TCA application. Result: out of total number of patients 25 who underwent this study, 14 patients had the unilateral central perforation and 11 patients had a bilateral central perforation. Etiologically, following data was recorded. A total number of 25 patients had inactive mucosal chronic otitis media, out of which 14 had unilateral disease and 11 had bilateral disease. 8 patients had history of undergoing laryngoplasty or tympanoplasty. 8 patients had history of trauma leading to central perforation. 9 patients had history of chronic otitis media. A total of 18 patients healed, 5 patients did not heal and 2 patients were lost on the follow-up. Out of 5 patients that didn't heal, 3 became active chronic otitis media who were put on conservative treatment and do not become inactive during the tenure of this study. 2 out of 5 went into surgical correction by type 1 tympanoplasty under general anesthesia. This clinical study showed that application of TCA for repairing perforation of pars tensa in tympanic membrane is an effective and efficacious non-surgical approach for treatment of mucosal chronic otitis media in selected patient. An overall success rate was 72% was achieved in this study. Discussion: worldwide, millions of patients suffer a significant decrease in quality of life due to perforation of tympanic membrane. Various pathophysiological mechanisms are known to cause a breach in the integrity of the tympanic membrane. Ruza in 1876 used a cauterizing agent to freshen up the epithelize the rim of perforation, which eventually hastened the process of healing and lead to success closure of tympanic membrane defect by a non-surgical approach. Otherwise, noteworthy attempts were made by Kunev in 1895, who used the TCA for the first time for same purpose. A non-surgical approach for any disease process is always more welcome than invasive surgical intervention and anesthesia and their side effect. In this study, we evaluate the efficiency of TCA to successful closure small size dry perforation when done under strict aseptic conditions with strictly structured follow-up program. The size of perforation is more important in determining the time of healing than its position. In our study, the overall success rate was 72%. Which means out of 25 patients which underwent the full tenure of the study, 18 were treated by a non-surgical approach out of 25 perforation that underwent TCA application in this study. With the result of this study, we can propose that all the patients that the fit fit the selection criteria for undergoing chemical cauterization by TC application should be offered and consulted undergoing this procedure before being advised to undergo surgical correction for treatment of chronic perforation of tympanic membrane. These are my references, and thank you.
I would request Dr. Amit Pradhan sir to hand over the certificate to Dr. Ashish. Next, Vedant Guru.